Hello and welcome everyone to this session in which we are going to be discussing anesthesia as a career option. A lot of you have messaged me on Telegram asking, ma'am, which college is good? Ma'am, is MD good? Is DNB good? What are our options post the residency? So, for answering all of these questions, I'm carrying out this session today. My name is Dr.Jhanvi. I'm a gold medalist in anesthesiology. I've completed my MD in anesthesiology from Tata Memorial Hospital. After that, I have given the secondary DNB exam. Sorry, not the secondary DNB, just the post MD DNB exam. And after that, I have done two fellowships. I've done a fellowship in neuro anesthesia, and I'm currently doing a fellowship in regional anesthesia. So for all of you who have any doubts of anesthesia, if you guys want to take up the branch, you want to know how much will you earn, how much time will you take to settle, is family life good or not in anesthesia? Today's session is absolutely for all of y'all. I will be whatever colleges, whatever ranks you want to know, you can ask me anything about anesthesia, and I will be more than happy to answer it for you guys. This is the Telegram group where you guys can message me any of your questions, and let's begin with our session for today. So first, you all can keep writing your questions and I will answer all of them. You can also use my code Dr.Jhanvi Live if you're planning to buy the plus subscription on Unacademy. Okay. So first of all, in anesthesia, what are the various options? So you can do either MD anesthesia, DA anesthesia. That is, MD anesthesia is a 3-year course. Okay, and this is mainly in all the government medical colleges. Then we have DA, which is diploma in anesthesiology. Okay, now this is also there in government medical colleges. So what happens when you do DA anesthesia? You have to do 2 years of anesthesia plus 1 year of bond. I'm talking about Maharashtra over here. Maharashtra has a 1 year bond. So I would highly not recommend you guys to take DA. Instead of taking DA, it's better to take 1 year drop. Why? Because after DA, you have to again give the NEET PG exam to get into secondary DNB. And on top of that, you will have two bonds to cover. One will be your post DA bond, and one will be your post DNB or whatever your UG bond. All of those things will be there. So this unnecessarily makes this course into almost a 5 year course instead of finishing it in 3 years. So if you are getting DNB instead, DNB again is a 3 year course, and DNB has no bond. Okay, MD comes with a bond, so you should know what state you are trying to get into and how many years of bond is there in that. You should look at that also. Trust me guys, life should start early. The more you keep doing residencies, fellowships and bonds, the older you become, and then when will your life start, when will you actually start earning, and when will you enjoy your life? Okay, so look for states which have lesser amount of bond, or look for, if you're getting in a good DNB institute also, absolutely go ahead with it, because DNB has no bond, so that is the advantage of DNB, and you trade well in DNB and come. Okay, so Anusha is asking 28,705, any chance of anesthesia in government, EWS reservation general? It's a little difficult to get into government at this rank, but DNB institute, yes, you can get in, and if you get a decent DNB institute, I would highly recommend you to go ahead with it. The fourth degree is CPS, that is College of Physicians and Surgeons. Okay, now this again is a degree which is only for 4 states in India. If you want to go abroad, then I would highly recommend you not to take this degree. If you guys want to stay in India, and specifically in the 4 states where CPS is happening, like I have a lot of my friends who have taken up CPS and who are based in Maharashtra itself, so it wasn't a problem for them to continue on the CPS degree. But if you're planning to even change states, if you're planning to go to Punjab, or you're planning to go to South India, or you're planning to go abroad, then CPS again is not a good degree. So if you ask me, your first choice should always be MD, yes, and DNB. Okay. Now, many of you all will underestimate DNB also, saying that no, ma'am, MD is better than DNB. MD only on paper is better than DMD. Trust me, when you go for jobs, when you apply for fellowships, when you go abroad, when you apply for DM, it will not matter whether you have done MD or DND at all. Okay. If you have trained from a good institute, you have got enough hands on, you have rotated in maximum number of specializations. You have seen cardiac anesthesia, you have seen neuro anesthesia, you have seen obstetric anesthesia, you have seen pediatric anesthesia. If you've rotated in most of the places, you are going to definitely be having an advantage over others as compared to those who have done MD from limited colleges. So let me give you my own example. All right. So I took up MD at Tata Memorial Hospital, and on the other hand, my option was to get DNB at Hinduja Hospital. Okay. Now I took up thinking that it is an MD, so definitely I should do MD. Now there were pros and cons of joining Tata also. In Tata, I got exposure to difficult airway, exposure to all the ICU protocols, exposure to the fact whether I want to take critical care ahead or not. Okay, so if you are planning to take critical care ahead, Tata Memorial Hospital is a very very good place to go and train, so that you will get an idea of what your life will be ahead for critical care. Similarly, many of you all don't think of anesthesia as an option. You all directly think metho anesthesia is just my means and ways of getting into critical care. So for critical care, if you're getting into a hospital, make sure that they have a good, well set up ICU which is managed by anesthetists. If you have just a two-bedded ICU under anesthesia care, you are not going to learn anything about critical care. Okay. So if you are planning to do that in the future after anesthesia, then go for a hospital which has good ICU, especially Tata Memorial Hospital in MDs, and in DNB you have Apollo Hospital, you have Hinduja Hospital in Mumbai. All of these have very good ICUs, so you will get a good exposure to critical care. Okay. On the other hand, what was the con of joining Tata for me was that I did not. It has onco anesthesia cases only, so I did not get much exposure to obstetric anesthesia. I did not get much exposure to regional anesthesia. So, to normal cases, the 1.5 2 hour cases, short cases, okay, so all those are the kind of cases when you go out into practice, those are the kind of cases that you're going to be doing day in and day out. So, you need to be an expert at it. So, only if you have done those kind of cases during your residency will you be confident going ahead and doing that outside. Okay, so from now only start thinking of your future. What I thought after finishing my MD was I was not very confident in regional anesthesia because there was not much regional, like spinal and blocks and everything in my hospital. So that's why I am trying to cover that gap by doing a fellowship in regional anesthesia at one of the best institutes in India. Okay. So don't get scared. Don't feel ki I have to choose an institute and this is my first and last institute to learn anesthesia currently. What are you supposed to do? You're supposed to choose an institute which will fulfill 80% of your criteria. You should be comfortable in that institute and it should have good exposure to most of the uh, specialities. Okay. Once that is done, after that, whatever is the lacunae in that institute, whatever are the gaps in that institute, 20%, 30%, whatever is left, you can cover it up in fellowships. Okay. Similarly, for DNB, I keep telling everyone again and again, DNB is an excellent degree if you do it from a good institute because the consultants over there are full time. So they are really interested in teaching and really interested in making sure that overall you grow research wise, academics wise, as well as skills wise. Only drawback in DNB is that sometimes if you have a very private hospital having a DNB, then they may not give you enough cutting or enough skill, and that is mainly because the patients are very VIP. Okay, but what happens at the end of the day, whatever in anesthesia as such, there is only basic skills that you require, like intubation, like fiber optic bronchoscopy, using video laryngoscopes, doing regional anesthesia, ultrasound use, and all of these are allowed by DNB hospitals even to residents because they are not very high fundu skills. Okay, so even if you have VIP patients, anesthesia is okay as a branch to take in DNB. They will let you do everything on those patients. The problematic branches become surgical branches, general surgery, orthopedics, because they involve very proper surgeries. So they are patients who are paying from their pocket, so they will not like to be operated by a trainee doctor or by a junior doctor. Okay. So as told you earlier, if you are planning for any kind of DNB in a medical branch, just go ahead with it if it is a good hospital, because you also save 1 year of that bond period. Okay, and if you save this 1 year of the bond period in DNB, you can use this for doing a fellowship or you can do it for doing a SR-ship in a good government medical college. Okay, so you can keep that 1 year of your life uh, extra for yourself. Okay, all right. Now next was, what is the duration of the course? So your MD DNB courses are all 3 years, your diploma courses are 2 years, and your bond depends on the state. So your bond can go anywhere from 1 year to 10 years. So before going to any other state, okay. So again, I'll give you my own example. I was interested in taking dermatology initially, and I saw that I was getting dermatology in Madras Medical College. Okay, but this was diploma in dermatology. So this was DVD, and after this diploma of dermatology, what was the thing? The bond was for 2 years. So it was a 2 year course with a bond for 2 years. So I thought, if I do this DVD for 2 years, then bond for 2 years, and after that secondary DNB for 2 years, so where does that put me? That makes the whole thing 6 years long. So instead of doing a 3 year residency, I am completing my course in 6 years. So am I ready to put in 3 extra years of my life? And what is the output? I will be a dermatologist. Okay, that's something that I aspire to be. But what is the market value of a dermatologist? That's also that you should think of. When you go outside, there are some branches. Now, for example, if you take dermatology, there will be many people trying that branch. Okay, there will be people who have done in simple MBBS, who will know some laser procedures, and they will go ahead for those branches. There will be people who have done dermatology and fellowships, and they will be having a clinic. There will be just self-proclaimed cosmetologists who will charge a bomb for dermat procedures. They will just learn how to do the procedures and they will carry it out. Unfortunately, in our country, before a person or a patient goes to a doctor, he will not check the degrees. Now they are becoming more aware, but in most of the places, they will not check the degree. They will just check the fees of the doctor. Okay. So in that case, the person who has the least amount of degree will probably charge less. So the more patients will go to them, and more patients will also go to the experienced doctor as compared to someone who has many degrees. Okay. So look at the market value of the branch before you join it. Similarly, many of y'all keep studying, and say, I want to take radiology only. I will give multiple attempts, 5 attempts, 6 attempts, and I'll take radiology. But once you pass out of radiology, you realize that currently there are DNB radiologists, there are DMRDs, there are so many people who do MBBS and then a short course in radiology, and all of them are practicing radiology outside. So that makes your competition group very big. Now, one hospital will require maximum 2 to 3 radiologists. If we are talking about a 50-bedded hospital, 2 radiologists is more than enough for them. But on the same hand, for every OT, you will require one anesthesiologist. So every hospital will have a minimum of 5 to 6 anesthesiologists. Okay. So see the job proportion also. Radiologists, the number of jobs versus the number of people doing radiology. There is a demand and supply mismatch. The demand for radiologists is so much and the supply of radiologists is so much. Okay. On the other hand, if you look at anesthesia, the demand supply mismatch is ekdam ulta. The demand for anesthesiologists is so much and the supply of anesthesiologists is so much. So the minute you go out of your residency, you are going to end up getting a job for sure, 100% in anesthesia. But radiology, you will have to look for many places. You will have to negotiate your salary. You will have to make sure that you compromise on many phases as compared to a branch like anesthesiology, where the demand is much more as compared to the supply. Okay. In anesthesia, you can even go and dictate your terms. You can tell them outside, no, I am not okay with a salary of 1 lakh. I want at least 1,20,000 rupees. So they will say, okay, 20,000 रुपए में ठीक है, we are anyways not getting an anesthetist, just let's take her and we'll do it. Okay. On the other hand, radiology mein there is so much competition in the market that they will be like, acha, this radiologist is asking 1 lakh, this radiologist is asking 1,05,000. So, and this radiologist is asking 95,000. So let me just take the one who is charging 95,000 rupees. Okay. So that is the kind of market competition that happens outside once you go out of your residency. Okay. Now answering a few questions, Definite is asking, can anesthetist own hospital? Absolutely, any anesthetist can own a hospital. You just need to employ doctors under yourself. You need to employ specialists under yourself who will be able to basically, you can be in a managerial position, then you stop practicing anesthesia or you practice it very less, and you can continue to have people under you who will work under you. Okay, so you can have orthopedic surgeons, you can have general surgeons, you can have gynecologists who are working under you. You will give them salary or you will give them a part of their earnings from whatever surgeries they have done. So to own a hospital, it does not matter whatever PG branch you take, you just need to have administrative qualities. Okay. Devanshi is asking, what about medicine jobs? Medicine, again, if you go out only as MD medicine, you will have competition from specialists as well as competition from just MBBS students who have trained under some people and gotten some experience in medicine. So that again becomes a very, very unfortunately wrong sort of choice to make, just doing MD medicine and practicing. If you have your own hospital or if you are planning to practice somewhere in periphery, in some small area where they don't have MD medicine, your practice will thrive. But if you're planning to practice in a big metropolitan city as MD medicine, trust me, getting a job in corporate is also not possible, and starting your own clinic is also not possible unless you do DM or unless you do fellowships or unless you go abroad and do something in a particular branch and come. Okay, so after MD medicine, DM becomes almost compulsory to do. So if you're doing MD medicine of 3 years, consider a DM of 3 more years and the bond of MD for 1 year and the bond of DM for 1 year. So starting from now, you are looking at least 8 more years of training life, of not consultancy, just training life. Okay. Okay. Now, Mith Kumar is asking, MD medicine in average college or DNB pediatrics in good college? Okay. Definitely, I would go for DNB pediatrics in a good college, but also take into account if you like children or no. I don't like children. That is why I try to stay away as far as from pediatrics that I can. But if you like children and if you like pediatrics, med and peds are quite similar. So you can go ahead with DNB pediatrics in good college. Okay. Uh, Anusha is saying, as an anesthetist, we cannot put up a clinic. Okay, you cannot put up a clinic, and there's someone who has answered a very similar question over here, who has asked a very similar question. Can we practice as GP in free time? Okay, so I personally know of an anesthetist who has given up his anesthesia practice and is practicing as a general practitioner. So definitely you can do that. I know of a gynecologist who has given up his practice and is teaching biology to 12th standard students who are appearing for NEET UG. Okay, so even after you do the residency and maybe you may do multiple fellowships and everything, the amount of options that you have later on is very different. Okay, so if you have your own general practitioner practice, or if you're bored of doing specialty practice, because I'll tell you, as a GP you can earn way more as compared to a surgeon who has just started out. Why? GPs end up getting a lot of money from just their daily practice, charging everyone 500 rupees for a single consultation, fever, cough, cold, vaccination, allergies, all of those things. Okay, so they have many number of patients and they have fixed hours, and home visits are even more. If you talk about home visits in a place like Mumbai, you can charge anywhere between 2000 to 3000 rupees per home visit. So actually, many people, if they are struggling to set up their specialist practice post residency, they go back to being a GP. Okay, so it's absolutely up to you. There is no branch in which you cannot come back and do GP practice. You can definitely do any of that. Okay. Immediately, can we get job like after anesthesia MD? Yes, Priyan. Exactly after MD anesthesia, the minute you get your degree in hand, the next day you apply. I assure you, you will get a job in at least 3 places, and out of those 3 places, you can even negotiate your salary. But for other branches like dermat, like medicine, like surgery, so if you're talking about dermat and radiology, there's a lot of competition outside. Getting a job is difficult. Many of the people end up setting up their own clinics. So when they set up their own clinics, that requires a lot of investment. Okay, so you should be having that kind of investment. Second type is, many people go abroad after this, so they train for another few years, 3 to 5 years abroad. Third possibility is that you keep doing fellowships or specialization after dermat and radiology, so that there is some extra thing in you as compared to others. Okay, if you do branches like medicine, surgery, pediatrics, then it has become almost mandatory to be doing some kind of DM or fellowship after that. So definitely those branches don't stop at residency itself. You have to go ahead for another degree or DNB, super specialty degree. Okay. Sanjana is asking, how is anesthesia department in MAMC? It's very good. The exposure to more than the department, you should be looking at the exposure to patients. If you're having different super specialties, as MAMC has cardiac, neuro, obstetric, orthopedic, all of those are excellent specialties that you should be exposed to during your residency, and definitely you will get that exposure in MAMC. Okay. Now, Sana is asking, after diploma, is it necessary to do secondary DNB? Of course, it is not necessary to do secondary DNB if you're going to be practicing in the periphery. Periphery means smaller cities. They will not really bother to see your degree. They will only bother to see whether you are sincere at your work. Are you ready to come at any time that they call you, or and how good anesthesia do you give? Okay, so if you are practicing freelancing, then in that case secondary DNB is not important. But if you plan to take up a job in a government medical college, or take up a job in a corporate hospital, a teaching job, or if you're competing for super specialization and all that, then in that case secondary DNB becomes mandatory, because they will definitely ask you what is there on your CV, and just a diploma on your CV does not look good, because diploma is hardly 2 years of experience as compared to people who do diploma and secondary DNB, which comes up to 4 years of experience. Okay. All right. Ambrosia is asking, regarding the bond in Maharashtra, is SR-ship included in bond after PG? Yes, absolutely. Senior residency is included in bond after PG, but you should also be looking at certain hospitals. If you are doing senior residency in a private hospital, that will not be counted as your bond. Okay, you have to be doing senior residency either in a government medical college, or in a deemed hospital like Tata Hospital, where it will be counted as a bond. Okay, all right. Chari is asking, how about emergency medicine in private sector as 3-year course and as a PG seat? Okay. Emergency medicine, even though now it may look at like a very nice option to take, remember, for emergency medicine, one thing is that you need to be on your toes all the time. Okay, so your entire shift, your shift of 8 hours or 10 hours, whatever hour shift it is, you will be continuously working. You will be dealing with very unstable patients, with trauma patients, with obstetric patients, with medical patients who are coming with an acute problem. Okay, so it is a fun branch, but try to look at yourself 20 years down the line. Do you want to always, constantly, every damn day that you go to work, do you want to be in that kind of a high pressure situation? If that gives you a kick, being in a high pressure situation, diagnosing something and then treating it, and constantly using your brains, mind, and being on your toes, then yes, go ahead with that as your option. If you are looking at a more stable option, something in which 8 hours of work is there, but you can six, maybe 5 or 6 hours, your work will be very hectic, but 2 hours your work will be a little light, then don't go for emergency medicine. Okay, because many of you all look at branches now without thinking of how your life will be 20 years down the line. So think of yourself, because the branch that you take is something that you will live for the rest of your life. So you should be ready to put in the best of your efforts in that branch. Okay. Okay. Sheikh is asking, ma'am, total years for intensivist and life as an intensivist. Okay. So total years of intensivist, you can do 3 years of either MD in medicine, or MD in anesthesia, or DNB in either of them. Okay. After that, you have to get your critical care branch. So maybe it will take 1 year for preparation for super specialty NEET PG, and after super specialty NEET, you get into a course that is for 3 years. Okay, so if you get into a course the another 3 years, and after this 3 years you can directly get a job, so it's almost 7 years from now. Another option is to do After 3 years of MD, do something called as IDCCM. IDCCM is Indian Diploma in Critical Care Medicine. It's a 1 year course. Of course, as compared to having someone who has done DM, you will get lesser amount of what to say. Your value as someone who has done IDCCM will be lesser as compared to someone who has done 3 years of DM. But if you are planning to work in smaller hospitals, they do not mind taking people who have done just a 1 year diploma course in critical care medicine. Okay, so depending on what kind of city or what kind of hospitals you want to get into, if you are working in cities like Mumbai, Pune, Bangalore, then doing a DM becomes mandatory to get into a good hospital. If you're doing going to practice in small nursing homes, or you're going to practice in two tier cities, then in that case you can just do 1 year of IDCCM and go ahead and practice as an intensivist. How is life as an intensivist while you are doing training as an intensivist? Initially, for the first 4 5 years, you will be doing practice in shifts, 8 8 hour shifts. In some places, it's almost a 10 to 12 hour shift. Those 10 to 12 hours or 8 hours will be extremely hectic. After that, once you're done with your shift, then you can go home and chill. But what happens is, you take that kind of whatever the patient's treatment diagnosis, because the next day you're going to be seeing the same patients, so you take that whatever is going on in your mind at work, you take it home and you keep thinking about it, and there are discussions about it, and you discuss with your seniors and juniors what are the possibilities, what is the treatment. So it's not like anesthesia where you are ending your work once the patient is out of the operation theater and you go home, then you don't have to think about the patient. Next day there will be a new patient. In critical care, you are carrying on the same thing about the patients from one day to the next day, and even at home you keep thinking a little bit about it. So critical care, definitely it is a very challenging branch and very nice branch, because if you save the patient who's critically ill, you will feel very very rewarded. But at the same time, imagine for the rest of your life, you're going to be living a life of high pressure situations. Okay, all right. Next question. After MD anesthesia, what scope do we have in anesthesia is Casper's question. Okay, good. So Casper, this is for you. These are our options. After MD anesthesia, you can directly start working as a freelancer. As a freelancer, you can go and do different cases in different hospitals, and you can earn a decent amount of money. Okay. If you want to study further, you have DM in all of these branches. So you have DM in critical care, DM in pain, onco anesthesia, DM neuro anesthesia, pediatric anesthesia, and cardiac anesthesia. This is another 3 years. Okay. On the other hand, if you don't want to do DM of 3 years, if you want to do fellowship instead, then you have 1 year or 2 2 year fellowships in all of these: pediatric, neuro, cardiac, regional, obstetric, and airway fellowships. So all these fellowships are available in India. So these are all your options post DNV or MD anesthesia. Okay. Okay. Then okay, definitely saying, ma'am, my rank is 8.6K. I love surgery and anesthesia. Both confused, please guide. Okay, you are you're talking about very, very different options. This, you have one on one side of the operation theater and other on other side of the operation theater. Okay, so the best way to know what you actually like is go to the operation theater, work there from, I'm not talking about go for 2 3 hours. Go to your medical college, go to a general surgery OT, and do it from morning 8 o'clock to evening 5 o'clock. Okay, so when you do that, you will know for how much what do you actually like. See a surgeon who is practicing, see an anesthetist who is practicing, and you will know what exactly is their day like. And surgery wale, even after OT, they will go to the ward and stay in the ward till 9 o'clock. Anesthetists, after OT, they will go home. Okay, so talk to those residents, try to get what kind of a person are you, what kind of life you want. You want a hectic life, you want a free life, you want fixed hours, you are okay with doing any number of hours, you want more money, or you're okay with a limited amount of money. All those questions you ask yourself. But the most important thing is, go spend those 3 days 8 to 5 in the OT, and that will be the best way to answer your question what you actually like. Okay, all right. Casper is asking, can we go for teaching jobs after MD anesthesia? Yes, absolutely. If you join in a teaching hospital, teaching government hospital or teaching private hospitals, DNB hospital, corporate, you can definitely teach along with practice. Sanjana is asking, is DM necessary after MD anesthesia? Not at all, Sanjana. Even after MD anesthesia, there are many jobs that are available. So DM is not at all mandatory after MD anesthesia. So don't worry about that at all. Okay. Okay, Sana is asking, what are the other specialties after MS OBGY other than IVF? I really don't know. I would have loved to answer this question for you, but this is not my specialty. So I have not really discovered much into it. Okay. All right. So, guys, you can keep asking me more questions and I will be happy to answer it for you. Meanwhile, I will tell you what are your work and responsibilities as a resident in anesthesia. Okay. So, as a resident in anesthesia, you will be rotating in the ICOT every day, definitely. ICU, you will be doing some months as a critical care physician. Pain OPD is one of the more upcoming things in anesthesia. So you will be taking care of patients with acute post-operative pain as well as chronic pain. Chronic pain, it can be anywhere like backache, sports injury, or cancer pain. So nowadays, people have started giving blocks, CT guided blocks with alcohol or with CT guided blocks with drugs that will help in eliminating the nerve pain. Okay, so pain is one of the upcoming branches in anesthesia, and that is also one of the OPD branches. You don't need to go to OT anymore if you are doing pain. Okay, all right. Now, what is your typical day in the life of an anesthesiologist? So, if you are an anesthesiologist, your typical day is going to start at around 8 a.m. in the morning. You will go to the operation theater. You will work till around 4 to 5 p.m. Okay, so your typical day, say it will be around 5 p.m. After this, you can go home. In this, you will be getting breaks for on time for breakfast, lunch, and dinner. So someone or the else will come and relieve you. So meal timings are not compromised. Why am I talking about this? There are some people who want to live a life which is little what to say, organized. Okay, like in surgery, you start your day at 6 a.m. in the morning. First, you'll go to the ward, you'll see the pre-op patients, then you take them to the OT. So your OT will start at 8 a.m. Then your OT gets over at 5 p.m. Once your OT ends, then again you go to your wards. Then wards may you will finish your day at 7 to 8 p.m. So your entire day is going on from 6 a.m. to 8 p.m. if you're talking about surgery. Okay. So when you are doing this, it's going to be very difficult for you guys to have any kind of a schedule for life, as well as for your eating pattern, your sleeping pattern. Everything is haywire in surgery. Okay, on the other hand, when you're doing anesthesia, this is how your life will be. It will be fixed hour duties and very organized. Okay, all right. Post residency career options we have answered. So you can do freelancing, you can do DM in all these places, you can do fellowships. Okay. Ambrosia is asking, ma'am, are there many emergencies while practicing if someone prefers fixed hours of working? Okay. When you are practicing as an anesthesiologist after your MD, Ambrosia, you can on your own decide what you want to do. Okay. So if you want to make some extra money, suppose you have just come out of your MD, you're fresh pass out, you are all enthusiastic to go and work, you can say yes to the surgeons for surgeries after 5 p.m. Anyone will call you, you can say 5 p.m. Okay, fine, I'll come. 7 p.m. Okay, fine, I'll come. But the suppose you get married or if you have a child and you're not able to give that kind of emergency timings to the surgeon, you can simply say no for those cases, and you can say that no, I work only from 8 a.m. to 5 p.m. So any cases in those timings, you can let me know, or you can call someone else for the emergency surgeries. The other thing that is possible in this case is if you want fixed hours of working, you join a government medical college or you join a corporate hospitals. They will give you fixed hours of working. 8 to 5 are most of the places, and you will have emergency duties once in a week. Okay, so once in a week you may have to stay back in the hospital or be prepared to be ready to induce emergency cases, and the next day mostly they will give you an off, so you also have a post call off, so the next day will be a holiday for you. Okay. Okay, Casper is asking, what about night shift in anesthesia? Night shifts in anesthesia or on-call duties in anesthesia are always fixed. As a resident, you will not get, you will get a duty 1 to 2 times a week, which involves night shifts. But the next day, you may or may not get a post call off. But as a consultant, in most of the places, you will get once a week on call duty, depending on how many consultants are there, and next day will definitely be an off. Okay, so most of the places give a post call off. Okay. What subjects have we got in anesthesia? Sanjana is asking. These are all the subjects that we have. So, are you talking about the subspecialties? So, the subspecialties in anesthesia are all of this: critical care, pain, onco anesthesia, neuro anesthesia, pediatric, cardiac, and airway. Okay, so these are all the subspecialties under anesthesia. Okay, Sonam has asked me a doubt. Let me see. Sonam is asking, why does the income become plateau at one stage? How can we increase it? Okay. So, Sonam, you can, okay, so this is Sonam's doubt. Why does the income become plateau at one stage? How can we increase it? So, if you are joining in one of the centers where you have fixed hours, so then your income will increase either every year. So they have a fixed way of increasing it: 5% increase, 10% increase, 15% increase every year on your income. Okay, so if you're joining corporate hospitals, if you're joining government hospitals, increase in income depends on your promotions. So when you're assistant professor, you get some amount of income. After 5 years, when you get associate professor post, then your income increases. Next 5 years ke baad, when you become a professor, your income increases. Okay, but if you want to increase your income rapidly, then there is one way to increase it, and that is by freelancing. Okay, so if you freelance, you can pick the number of cases. If you do, for example, let's just say, for example, you're doing x number of cases. Okay, so within, you say I want to work only 9 to 3, and in that 9 to 3 you get x number of cases. Then if you want to earn more, you can increase your working hours from 9 to 6, and you will do 5x number of cases, so your income will also increase. So your experience is one of the things, and your hard work is the other thing that will help in increasing your income. The more you want to earn, the more you have to practice. There is no way out of this. Okay. Positivity, King George Lucknow, SGPGI Lucknow, both are excellent institutes. You can go for any of those institutes. They are more renowned and famous institutes for anesthesia. So definitely take any of them possible. Okay. All right. Then we have, okay, Rajat is asking, ma'am, how is life and future after DM pain and onco anesthesia? Okay, so in after DM pain and onco anesthesia, you need to be joining any one of the upcoming cancer centers. In government sector, we have Tata Memorial Hospital, and in non-government centers, we have many of these private hospitals and HCG centers. HCG is one of the private centers which is coming up with cancer hospitals all over India. Other than that, AIMS also has its own critical care unit. Then you have many corporate hospitals with their own cancer wing. Sorry, I'm talking about cancer wings. Okay, onco anesthesia. So if you will have to join in one of these institutes. So freelancing becomes a little difficult in case if you do DM, onco anesthesia, and pain. You would rather go into teaching job in a hospital which has only onco anesthesia. Okay, all right. Okay, so now let's come to this. BJMC Ahmedabad is also very good. BJMC Baroda is okay, but BJMC Ahmedabad is very good. Okay, all right. So, what is your income like? If you're talking about the typical income post residency, now I'm giving you an idea about Mumbai. Okay, a city like Mumbai. In a city like Mumbai, post residency, immediately post your residency, when you join as a senior resident, you can expect to earn about 80,000 rupees in salary. uh, this may vary in which center you are joining. 80,000 to 1 lakh anywhere. Even if you join in a private hospital, they may even give you 1 lakh rupees. Okay, if you join post 1 year fellowship, your salary can be anywhere between 1 to 1.2 lakh rupees. Then there is one more place, that is post 3 years DM. If you join post 3 years of, sorry, post 3 years of MD, post after MD 3 year experience, then in that case you get a salary of about say 1.2 to 1.5 lakh. I'm talking about per month everywhere. Okay, and post DM you can start off with a salary of 1.5 to 1.75 lakh per month. Now this is strictly about Mumbai. If you start freelancing, okay, if you start freelancing, then it depends on how many cases you do per day and how many hours you put. If suppose you work from 9 to 6 p.m., you can earn anywhere between 1.5 to 2 lakh rupees in, this is just post MD. Okay, in freelancing you should be aware that your experience does not matter. If you are more experienced or less experienced, it does not matter. They will not give you more money if you are more experienced. The anesthesia fees is fixed, and you just have to do the case. Once you do the case, you will get the money. Okay, so in freelancing it only depends on the amount of hard work that you put in. If you do more cases, you earn more money. Okay, all right. Ma'am, how is Osmania Hyderabad for anesthesia? It's a good college. Definitely, it's one of the. Okay, so now since many of you all were asking me, we'll come to the study abroad option. One of you all were asking me, Vignesh, I'll answer your question. Now, these have listed for you guys over here the best MD institutes in anesthesia and the best DNB institutes in anesthesia, and these are all state wise. Okay, so Maharashtra, North India, and Western India and South India. All of these are very, very good institutes, so you can get into any of them. If you're getting a degree, first go for MD, then go for DNB. Okay, out of that also, if you're getting in a not very good MD hospital and a very good DNB hospital, then go for a very good DNB hospital. Okay, so this is your list. Please go through the list at the end of the session. You can download the PDF and use this list. Okay, for knowing which are the good hospitals and which hospitals should you be putting on in your um, preference list. Okay, all right. Sonam has asked a doubt. I thought anesthesia was not a hectic branch but with less stress, but I've heard the opposite recently. Okay. Anesthesia is definitely, I cannot say that it is not a hectic branch. There is absolutely work in it. So, in anesthesia, you will have a 8 to 5 p.m. sort of a duty in most of the places. Okay. Now, in this duty, it depends where you work. If you're working in government medical colleges, here you will have, and also DNB colleges. Here you are going to have students under you. So you just have to tell the students what to do, and you have to teach them, and you have to help them improve their skills. Okay. So then it becomes not so hectic, as your main work is that of supervising along with giving anesthesia. Uh, if you are freelancing, then you're all on your own. Okay, no one is going to help you out when you're freelancing, so you have to do everything on your own in that case. So as a result of that, you have to make sure that MS Ramaya is a private institute. Okay, so when you're freelancing, you have to work on your own. You will not have anyone to help you out. The entire case from beginning to end, you have to do it on your own. So as a result of this, it becomes a hectic branch. So it totally depends on the place that you are trying to get into and how hectic is the branch. Okay. All right. Okay. So any other doubts? So let's see some of the boons and cons of anesthesia. Okay. Biggest boon is timing. You can choose to have fixed timing. Second boon is money. It depends absolutely on you. If you want a fixed salary, you can join into a hospital, corporate or a government hospital. If you want to earn more money, you can freelance. Okay, even in freelancing it depends. You can totally dictate your timings. If you say I want to work only 9 to 3, you can refuse the cases after 3 p.m. If you say I want to work 9 to 9, you can keep taking cases. And once the surgeon knows that you're available at all these timings, they will call you for it. Okay. Next is responsibility. So if you're freelancing, the entire responsibility is on you. But if you're in a government or a corporate institute, then in that case, the responsibility comes on the hospital and on the head of the department. Okay, so you're sort of protected in that case if you're working in one of the hospitals. Okay. MAMC versus MMC, which is better? I am from South India. Bond is for 5 years in MMC, no bond in MAMC. I would definitely go for MAMC in that case. Okay. Even if you're from South India, I think you won't find it that difficult to settle in Delhi. Delhi is a very easy place to live in. Only little problem will be in speaking Hindi if you don't know how to speak Hindi very well. So that you will pick it up in your first year of residency. But if you are getting to save time by not doing a bond, then definitely go for that. Okay. All right. Now, what are the cons of anesthesia? Cons of anesthesia is it is a branch which requires all your attention. Okay. So if you have a difficult airway, if you have an obstetric bleeding, if you have a failed spinal, all these are cases where you have to be present. Definitely be present for the case. You cannot just leave it on your juniors and go, or you can't be staying at home and tell them, okay, I'll come after half an hour, 45 minutes, make the patient wait. Okay. In all these kind of situations, the patient, it's a do or die situation. So your patient is going to not have more than 10 minutes. If you don't, cardiac arrest, difficult airway, not able to ventilate the patient, all this requires your presence. Okay. So you have just 10 minutes to save the patient. So this becomes a little stressful situation sometimes. Okay. Then so you have to make sure that you're giving your complete attention to the patient when you are in the OT. Then the second con about anesthesia is how to negotiate your salary. Okay. Because there are many people who do anesthesia. So you have people who do MD, you have people who do DND, you have people who do CPS, you have people who do DA. All of them start working in the same environment. Suppose all of them are working in your city. How to negotiate your salary? At the end of the day, all of them are able to give spinal anesthesia, epidural anesthesia, and GA. Okay. So in this case, this is when where freelancing is one of the cons, because here the surgeon will choose the person who is charging him the least. Okay. On the other hand, if you go to a corporate hospital, or if you go to a government hospital, then you will have a fixed salary. And here your degree will matter a lot. So if you have a CPS or a DA, you will get paid much lesser as compared to a MD or a DNB. Okay. So these are the two cons of anesthesia that I can think about. Okay. Now, why is anesthesia a ladies' special branch? If you see, most of the anesthetists are females. The ratio of females to males is almost 70% to 30% in case of anesthesia. Okay. Why? Because one of the things is, the the men feel that I don't want to be able to be answerable to anyone. Okay. Many a times people say you're answerable to the surgeon, you have to do as per the surgeon says. All those things are changing nowadays. Initially the anesthetist used to say whatever the anesthetist used to do whatever the surgeon says, but now with more and more awareness about safe practices in operation theater, all that is changing. And it's not like the surgeon is the dictator. You still can put your point forward and you can tell them if you have a valid explanation behind it. Okay. So most of the places, men don't like to be dictated by other men. That's why they don't end up taking anesthesia. So one is ego issue. Females definitely don't have that problem. I think we come around and we have a more liberal approach. If someone asks us to do something, we will ask them the ideology behind it. If we feel it is a rational ideology, we will accept it. If we feel if it's an irrational ideology, we'll put forward a point. I feel that the ego issues in case of that is less. Okay. What is the second reason why ladies take this more? It is a branch which is not very hectic. Okay. So why do I say not very hectic? Once you give anesthesia to your patient, suppose you are giving GA, once you have put the tube inside, once the patient is anesthetized, once the surgery starts, you can sit down, you can monitor the patient. Now throughout the surgery, you just have to monitor the patient. In that case, you don't really have to run around much unless you have a high risk patient or the surgery is getting complicated and there is continuous bleeding. So that will, in 90% of the times, anesthesia, after you have given anesthesia, you can just sit and monitor. 10% of the times there will be little bit of running around. Okay. So at the end of the day, you will not be extremely tired. If you're taking a branch like emergency medicine, critical care, surgery, you will be on your toes all the time. So you will be using, at the end of the day, when you come home, you're going to be super tired, and as a result of this, family time will get compromised in those hectic branches. But family time in anesthesia is definitely possible. You can have fixed routine working hours, and when you go home, you will not be very tired. You can cook, you can play with your children, you can teach them. All that is very much possible when you are doing anesthesia. Okay, so these are the few, and that is why anesthesia is preferred by girls. So these are everything about anesthesia, the best institutes, the pros, cons. Oh yes, I forgot to answer this. What about studying abroad? So one more thing, let me answer. What are your options to study abroad? So once you finish anesthesia, okay, now this is after MD or DNB, you can go to a few countries which, and here anesthesia is considered as one of the best branches. Okay, so you have UK, USA, and Australia. To go into the UK, there are two ways. You can go directly. How do you go directly? You apply for something called as MTI. MTI is a Medical Training Initiative post. If you go on MTI site, Medical Training Initiative UK, you will see over there. So you have to have someone in India who will recommend you to certain hospitals which have MTI post in the UK. Okay. So once you get this post, you have to work for a minimum of 2 years in that post, and meanwhile you can give your FRCA exams. Okay, FRCA has part 1 and part 2, so you can give those. Now the other option is, first give FRCA part 1, then get a fellowship in the UK. Again you have to apply online, and then you give FRCA part 2 after 1 year of working in the UK. Okay, now after doing FRCA, you will not get a consultant post directly in the UK. FRCA is moderately difficult to pass. It's not very easy, it's not very difficult, it's moderately difficult to pass. Okay, so after doing FRCA, don't think you will become a consultant directly. If you have done FRCA, you cannot enter into UK as a consultant again. I mean, you cannot get a consultant post, you have to enter into something called as training. So you have to enter into training, which is another sort of residency only. Okay, so this training can be anywhere between 4 to 6 years, and after that you will become a permanent consultant in the UK. Okay, so if you're thinking of doing FRCA and consultancy, then it will be 3 years of MD plus 1 year of getting into the UK, plus 2 years of your MTI post or FRCA post, plus 6 years of training. So another 12 years. So from now, count 12 years to become a permanent consultant in the UK. Okay. USA, there is no difficult way, direct way to get into the USA. You have to give your USMLE steps, and once you finish your USMLE steps, then you have to apply for the match. Okay, your residency match, national residency match program. And once you apply for the match, you may or may not get into anesthesia. Anesthesia is one of the top branches that people want over there. So in the USA, because it's one of the most paying branches in the USA. Okay, so it's very difficult to get into anesthesia. But if you have done an MD or a DNB in India, and if you go over there for 1 or 2 months, work under someone, get a letter of recommendation from an American anesthesiologist, then you can and give your USMLE steps and get good scores in them, then you have a chance or a shot at getting anesthesia there. So giving the USMLE steps will take at least 2 years, and the match process will take another 1 year. So after 3 years, you have to enter again into anesthesia residency in the US, which is 4 years. Okay, so to become a consultant in the US, you will require how many years? So UK was 12 more years from counting from now on. USA, 3 years of MD or DNB in India, plus 2 years of giving the steps, USMLE steps. After that, the next thing, yes, Vignesh, you can give FRC, primary FRCA during residency. After 2 years of giving the USMLE steps, then you have 3 years of residency, 4 years of anesthesia residency. So to become a consultant in the US, it's going to take you about 9 years from now. Okay. Australia is the third option. Australia does not prefer anesthesiologists as such, it prefers critical care physicians. So if you have some sort of a contact in over here only, suppose you train in intensive care, so after 3 years of MD you do either 1 year of IDCCM or you can do 3 years of DM. Okay, after that you apply for a fellowship in Australia. Once you get into Australia, it's very very difficult and it's only for critical care, and you need someone in India to recommend you to get into Australia. Okay, so once you are done with that, then you have to again enter training into Australia, which can take another 3 to 4 years. So the whole process goes up to 11 to 12 years, and it's only for critical care. Okay, so these are all your options. Anyone wants to ask anything else? Europe is not very easy to get into as an anesthesiologist. You may have to repeat all your degrees again. Given a choice between pediatrics and ophthalmology, which branch is better for settling down? I would say pediatrics, because now if you go out, the requirement for pediatricians is a lot as compared to ophthalmologists. There are many ophthalmologists, people who are doing MD, DNB, D ophthal, and for ophthal you may or may not need your own setup also. Getting into hospitals also has become difficult now because of the competition. So setting up again requires a lot of money. So I would definitely go for pediatrics. There are more jobs in pediatrics as compared to ophthalm. What qualities should one have in first year? Should just be sincere at working. That's it. Vignesh is asking, what about UAE? Okay. Yes. So if you want to go to the UAE, as an anesthesiologist, you need to give FRCA Part 1 and Part 2. That will get you a good job in UAE. Actually, in UAE, all the cities, Dubai, Abu Dhabi, have their own exams. So you can give those exams and you can get into a hospital, but you will not get a very good post. If you want a very good post as an anesthesiology consultant, then first do your FRCA for 2 years in the UK and then come to UAE. Okay. All right. Anything about EDIAC? EDIAC, okay, European, that is European Diploma in Anesthesia and Intensive Care. It is just an exam that you need to give. It's a two-part exam. So one first exam can be given in India, and the second exam has to be given abroad in some European country because it's a practical exam. Preparation takes about 1 year, and preparation and giving the exam can be done in 1 year. If you have given EDIAC, you do not need to give FRCA Part 1. It is considered the same as FRCA Part 1. So with EDIAC, you can directly give FRCA Part 2. Okay. Any other doubts, guys? About anesthesia? About hospitals? Which hospital is good for anesthesia? Which hospital is bad for anesthesia? Okay. So if I've answered most of your questions, we can wrap it up for today. I hope that this session was useful to you guys. On a parting note, I just want to tell you guys that whatever choice you make, just please order of preference for Delhi colleges. Okay, so here we have Delhi. Have I put Delhi over here? I have not put Delhi over here, but you can go for MAMC, Gangaram, and LHMC. They are the top colleges. I would go for MAMC first, then LHMC, and then Gangaram. Okay. ESI hospitals are also good. They have quite a bit of caseload, so you will be able to manage well in ESI hospitals. VMMC, I'm not very sure because I don't have many people that I know from VMMC. In fact, I don't know anyone from VMMC, but I know people personally who have trained from MAMC and LHMC, and they are good. Okay. Yes, UCMS is also good. One second. I'll just write it down for you guys. If you ask me, I would go for MAMC, then UCMS, LHMC, and Gangaram. This would be my order of preferences in Delhi. Okay. Obviously, if you're planning to do critical care, then please do ask about the ICU setups in all of these hospitals. Okay. I am not putting VMMC over here because I don't know anyone from VMMC. So that is why I don't want to comment about it. But if you have friends in VMMC, you can definitely ask them and find out. Okay. All right. Okay. So, and if anyone is planning to do critical care, be specific to ask them if the ICU setup over there is good and if it is managed by anesthesiologists or not. All right. Okay. So thank you so much, guys, and I will see you next time. Till then, take care and all the very best for your future. Bye bye.